So I'd like to just show you some tips and tricks on doing blood pressures, on getting pulses, and then you need to practice to do this. I would say practice with family, practice with boyfriend, girlfriend, grandparents, children, get your hands on as many healthy people as you can to start finding the differences of where pulses are, the different speeds, the different strengths, and so that you start to get a little bit of confidence when it comes to setting up and ascertaining or assessing somebody's blood pressure or pulse. You line up these little tubes more or less where the artery is that we're going to be assessing. The second thing you do, this nice and tight, is put this in that little spot. Boom, now it's out of the way. Now I don't have to touch it. And now here's my valve, here's my bulb, and right is tight, left is loose. Okay, we know that. This is an important thing to be able to do. You need to be able to handle this like this. You're not holding it off to the side, and you're not using two hands. You just tighten it just enough that it's going to inflate, and then you can turn it off. If this arm is at all flopped to the side, it's going to be harder to hear that pulse. When you straighten an arm out flat like this, or straight, you can feel the pulse right where you need it to put the stethoscope in. So I'm going to put it on, get ready to go, make sure that I'm in the right spot, and then I take my patient's arm. I'm not really worried about it. They got their arm here. I'm wearing clothing. I'm not going to do this if there's blood or something on there that I don't want on my gear. But I just kind of put it near mid-axillary, lock it in with my elbow. And then my hand sits across, and it should be able to find the pulse. Once I find that pulse, I put the bell of the stethoscope there, and it's out of the way. Now, I tighten this, inflate, and as I drop this down, I go up to about, what did they tell you, 160, 140, like that, and then I just crack it. This little thing should be falling at about 2 of those hash marks a second. Watching, don't hear anything, don't hear anything, don't hear anything. There you go. 1, 2, 3. I'm hearing that about 118. Boom. Still going. Get stronger. Stronger. Boom. Real strong. Boom. Still going. Up. Getting softer, softer. About 62. 118 over 62. I first heard it beating at 118. It gets louder. Boom, boom, boom. At some point it goes, you can feel the blood is literally going through the artery now. And that's what we're hearing. It's the blood bouncing against the tip of the stethoscope. And it's going to bounce until that artery goes from closed all the way to open again. Once it's open again, I don't hear anything. So that's the time that I counted done. The first one is 118, that's the systolic. It beats all the way down through 110, 105, 90, 90, or 80, 85, 80, 70, 60. It went down to, what did I say, 68? Mm-hmm. Okay, and then I don't hear it. That's your range, and that's what we're going for. Much easier if you lock it in like this, hold it like this. You can stare and work it over here. That's what we're trying to do. Does that seem a little easier to do? Okay, great. Let's give that a shot.